Hello, SYNGAP Land. My name is Michael Graglia. Today is Thursday, November 10th, and this is episode 81 of SYNGAP 10, your 10-minute weekly briefing on everything you need to know about SYNGAP 1. This Saturday in Atlanta, I will be there for the first annual SYNGAP soiree. It's going to be epic. If you're anywhere near Atlanta, join us. On Monday, two things that are cool are happening. First, Stoke Therapeutics will be giving an update on their phase 1/2A studies of STK-001. What is STK-001, Mike? STK-001 is a poison exon skipping ASO for Dravet. Mike, this is a SYNGAP podcast. Why are you talking about Dravet? Well, Dravet and SYNGAP have a lot in common. They're both neurohaploinsufficiencies. They're both blessed to have Stoke Therapeutics working on them, and everything that Stoke does with Dravet, they're going to learn from and then do for SYNGAP 1, inshallah. So, yeah, pay close attention to what Stoke's doing. Go ahead and watch that update on Monday if you can. And if you can't, don't worry. I'm going to watch it like 5 times and ask them a lot of questions. Then I'm going to talk about it later next week. But then also on Monday and Tuesday, I will be at the Personalized Medicine Coalition meeting entitled Personalized Medicine and the Patient. So I'll be one of the patients in the room talking about the patient perspective. That's going to be really, really cool, and I'm grateful to be there. And I will be singing from the rooftops about SYNGAP 1 and rare neurological disease. So that's all very, very cool. And really, though, what I want to talk about is the event on October 1st and 2nd in Nashville. And this, my friends, this is a big one. So if you haven't heard me say it before, we're having a major meeting on December 1st, the Thursday. All neurologists are welcome, and you should tell your neurologist about it and say, hey, are you going to AES? AES is the American Epilepsy Society, big annual meeting. It's like summer camp for neurologists. They all go. And you say, hey, just the day before AES, there's a beautiful calendar of events happening. Everything you ever need to know about SYNGAP 1. And we do it at AES every year on purpose so that neurologists can come in and learn more. And this year we're killing it. We have an NIH-supported meeting. Thank you very much, Anna Pedori and Vicky Whittemore and the NIH. And we've got this amazing meeting on the Thursday. And then on the Friday, we have a family-only meeting. I'm going to tell you about both schedules really, really fast because you got to know how cool this meeting is. On Thursday, December 1st, we have a welcome hosted by Ingrid Sheffer, one of the greatest living child neurologists. She's amazing. Ed Kay, CEO of Stoke, will talk about Tango and how their ASOs work. Dr. Timothy Yu, who is also a legend, will talk about N of 1s or nano-rare diseases. Jeff Collar will talk about mRNA amplifiers. Jeff's a big deal. In the next session, hosted by Ingo Helbig, chief neurologist at TROP, just a rock star guy. Dr. Kim Wiltrout will talk about our Citizen data. By the way, if you haven't signed up for Citizen, we have over 188 patients in Citizen. Sign up for Citizen. Make sure your data is getting in front of these geniuses to inform the drug companies I'm going to talk about to improve our trials and our chance of success. We have an ethical obligation as parents to share our data for the benefit of our children and our community, and Citizen is the best way to do it. Sign up for Citizen. Join the 190 people who are already there. Okay, commercial complete. At 10:25, Danielle Andrade, who is the world's leading expert. And when I say world's leading expert, I'm not making stuff up, people. Like, this is like a rock star collection. This is like SYNGAP-A-PALOOZA. I cannot believe we didn't call this SYNGAP-A-PALOOZA. That would have been amazing. Dr. Danielle Andrade talking about adults with SYNGAP. Dr. Andrade's the bomb. It's that simple. Dr. Connie Smith, Dr. Connie Smith Hicks will be talking about sleep and SYNGAP. And if you're a SYNGAP parent, you know that's a big one. And then Dr. Bruce Reeve will be talking about ORCA, which is something I've talked about in the past. Very important. We're going to use it for trials. In the afternoon, Rick Huganier chairing. I mean, we got nothing but heavy hitters. We got Ingrid, we got Ingo, and then we're breaking the eye pattern with Rick. But it's cool. Rick's cool. We got Gavin Rimbaugh talking about isoform, Sally Till talking about rat and other rodent models. She'd probably just talk about rats. She's really excited about rats. And then Elizabeth Heller will talk about epigenetic regulation. If you've been paying attention, we funded a postdoc in Dr. Heller's lab. She's fabulous. And then in the afternoon, finishing strong, Dr. Anna Pedori, the black fan professor of something at Boston Children's Hospital, a very big deal and an absolutely wonderful human being, will be chairing a session with Dr. Jacqueline French from NYU, who's a legend, and Vicky Whittemore from the NIH. Pretty amazing. As if it couldn't get better. As if it couldn't get better. And then there'll be like breakout sessions or whatever. And if it couldn't get better, that evening, we are hosting a reception in partnership with SLC 6A1, which is Amber Freed's shop, Combined Brain, which is this incredible umbrella group that we belong to, and it's led by Terry Jo Bichelle, and Combined Brain is just so cool, and our friends at Invitae. So the four of us will be jointly hosting a reception for rare advocates. It's going to be epic. Thursday night at, get this, Nudies Honky Tonk. Do not wear a suit, people. This is a boots and jeans kind of situation. So that's just Thursday, December 1st. On Friday, December 2nd, we're having a families-only meeting. This meeting will almost entirely be families. It's like a couple of close friends of the fund who might be in the room, but for the most part, it's all just families. And before I forget, I know of 8 families bringing SYNGAPians. Simon's will be there, and they will be prepared with a phlebotomist, and they'll be prepared to take blood samples from you and your children to increase their SYNGAP biobank. Please, please, please do this. Aaron Harding should be calling you, those of you bringing your kids, to invite you to do this. Please do it. It's super important that we get these samples, and Simon is an exceptional partner. So while that's going on, and also we're going to have a special surprise guest doing interviews for a podcast in another room. So we got a lot going on. But in the main stage at SYNGAP-A-PALOOZA, I cannot believe we didn't call this SYNGAP-A-PALOOZA. Lauren's going to welcome everybody for breakfast, and Lauren, to be very clear, has done all the work for this. If you talk to Lauren, thank Lauren. At 8:30, we're going to have Becky Sansbury talking about resilience and resources and how to live this life with a SYNGAPian. Becky, we're bringing her in. She's a pro. She's just so kind and lovely, and you're just going to love her. So she'll be running that session with Nancy, our very own Nancy from the board. At 11, we're going to have registries. Invitae Citizen's going to talk. Simons is going to talk. RareX is going to talk. Fabulous crew. At 12:30, we're going to have Kathie Bishop from Acadia Pharmaceuticals talking about getting clinical trial ready. I don't have time to go over Kathie's bio, although I should probably get it for the meeting. Kathie's a big deal. Kathie was part of the team that launched one of the first SMA drugs. She's very kind, and we have the privilege of talking to her once a month. Praxis will be talking right after that. Jackie Kancir, our very own Jackie Kancir, will be talking about behaviors after that. JR will be doing her book launch, More of Everything, and that's a book about her 20 years with the SYNGAPians. So I've asked them to bring books. Don't worry, the books are on us. You'll all get a book. You'll all get to hear JR talk about it. She's really cool. You're going to love that one. And then Vicky will talk about FONDO SYNGAP and our work in Latin America. Rebecca, Peter, and Pavel will talk about... Peter and Pavel will talk about the 2022 in review. It's been an epic year. We've done a lot. And then I'll be talking about the future. Can't wait to see what I'm going to say. And then, much like our reception on the 1st... Sorry, I just kicked the mic. If that was loud, I'm sorry. On December 1st, we're going to talk about what? We're going to talk about... after this, on December 2nd, we're going to have a community dinner. So we've rented out an entire floor of a restaurant, and we're gonna sit as a community and absorb these 2 days. That meal is not cheap. I'm telling you, that's costing me I don't know, it's costing me a lot. But so I've asked everybody to buy a ticket for just $20. It's costing me a lot more than $20, let me tell you. And I've asked people to buy tickets just so we know you're coming, because we're gonna buy you a seat. And it's going to be a great meal. So you got to sign up for all these things. You got to sign up for the meeting, links in the show notes. You got to sign up for Nudie Tonky Tonk, links in the show notes. You got to sign up for the dinner, links in the show notes. Join us. Let's, as a community, come together. And if you have grandparents, friends, supporters, donors, brothers, cousins, uncles, whatever, you're like, gosh, they should really be there. Invite them. It's not too late. Let's come together. Hotel rooms are not going to be easy to find, but you can Airbnb or something. This is going to be an amazing meeting, and you should come. I got to cover a couple other things real quick. Talked about that. In episode 80, which was the previous episode, I talked about ASOs and the ASOs in the New York Times article about KCNT1. If you haven't listened to it, go listen to it. The New York Times is the gift that keeps giving. They just put out another article about Pompe disease where they, I don't have time to talk about it, but they caught a child in utero with a disease, and they treated this child in utero because that's when the disease does its damage, and the child seems to be okay. So I share that because it's exciting, it's positive, it's uplifting, and it reminds us that this stuff isn't sci-fi anymore, guys. There's a lot of cool things happening out there, and we're going to be one of those success stories. We are going to be one of the populations who is effectively treated by ASOs, by Stoke and others. And so it's incumbent on us as parents to learn more. So last week I shared a pretty sad story about KCNT1 where there was a side effect of hydrocephalus, and I basically made the point that KCNT1 and SYNGAP1 are different enough, and what the ASOs were trying to do, knock down missense versus upregulate wild type, We're sufficiently different that we should pay attention to that. We should learn about that, but I don't think it should deter us from ASOs. And there's a blog written by a guy who's a researcher at the Broad and a prion parent. Prion is yet another terrible disease. And he wrote a really good blog, and when you try to read it, it'll be immediately obvious this guy's smarter than most of us. And I just want to encourage you to read the blog, and I want to read you a couple quotes from it. Why read the blog if it's going to be a little sciencey? Because you're going to have a chance to put an ASO in your kid. I don't know if it's going to be 1 year or 2 years or 3 years or a clinical trial of a marketed drug. I don't know. But it's coming, folks. Believe me, the future is coming. That's why I want you to read this blog. That's why I want you to come to Nashville, because you're going to have some you're going to have the privilege. You're going to have the great privilege of choosing to put novel, cutting-edge medicines into your child. And you got to be ready, because that's going to require some thinking. So come to Nashville. We're going to talk a lot about this and read this blog. So this dad says, we are working to develop an ASO against PRNP as a therapy for prion disease. So I just said that, I'm repeating myself. But here's the 2 quotes that matter. First quote, overall, it's hard to know whether there exists an association between nusinersen, it's called nusinersen, and hydrocephalus. Nusinersen was a drug for SMA. About 11,000 patients have taken it. So there's a lot of data there. If there is, the effect size is not huge and the frequency appears low. No patients appear to have died from it. So that's huge, right? Last week we talked about 2 patients who had KCNT1. One of them potentially died from the drug. N of 2. He's saying, hey, remember SMA, which is another ASO drug that we've dosed that is approved, is marketed. We've dosed 11,000 patients, 0 deaths, right? So that just to calibrate a little bit, right? I don't believe that the tragic results reported from valeriacin, should hold us back from bringing prion disease ASOs into the trials. Scratch out prion, write SYNGAP-1. I feel the same way. But this is one more reminder that clinical trial experiments and the first in human dose of a drug is really the starting line, not the finish line. We're at the starting line. Why am I so tired if we're not even at the starting line yet? Who knows? But we're approaching the starting line. And that's why the first thing I said at the top of this very long and very dense podcast, I'm sorry about that, was, hey, dial into Monday's update with Stoke Therapeutics. Why? Because they're at the starting line. Phase 1, 2A trials are the starting line for Dravet. And Dravet is like our older sibling in this horrible world of rare genetic epilepsies. Both neurohaploinsufficiencies, blah, 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 blah. So Stoke and Dravet are just past the starting line. We are at the starting line getting ready to go. And as parents, we got to learn about SYNGAP-1. So learn about Stoke, learn about ASOs, read the blog, and come to SYNGAP-A-PALOOZA. I already know who's going to hate that name, but I think I'm going to call this blog SYNGAP-A-PALOOZA Overview because it's such a cool name. Yeah, I'm going to do it. And I just want to, since I'm just reading my show notes, I just want 4 more things. Reminder, SMA, there's 3 marketed drugs, genetic therapies. That's where we're going. Angelman, there's 3 trials for ASOs right now. Dravet, there's 7 trials. 6 of them are for small molecules. 1 of them is for an ASO, and that's the Stoke STK-001, which I talked about at the top. Last thing I want to share with you, remember that wonderful cannonball we did where Brett and company raised over $150,000 for our kids? They got another interview. This is like the gift that keeps giving. And if you go to syngapresearchfund.org/cannonball, you can see all the press we got from that amazing event. And you should listen to that radio interview because it's just so cool. And you get to hear Brett talk. He's such a good talker. So thanks for listening. Please come to SYNGAP-A-PALOOZA, a.k.a. the SYNGAP-1 meeting. You should have a postcard. If you didn't get a postcard from SRF with this agenda, that means we don't have your address. Email Lauren, make sure we have your address. Come to this meeting. I don't need you to come to this meeting to make a success. It's already the room's going to be full. But I need you to come to this meeting because you need to be there. You need to meet the people who are there. You need to learn what's going to be said there. It is a big deal. SYNGAP-A-PALOOZA. Such a cool name.